Okay.
Well, I'm taking a look at your labs and your story as far as kind of putting it all together. I had some questions for you, but why don't you start? I'm going to figure out a way to minimize the screen a little bit so I
Okay.
can grab the notes I wanted to. Okay, go ahead.
For sure. So I'll start off a little bit about the conversation I actually had with the doctor who prescribed me the antibiotic, and I spoke to her earlier today. And
Wait. When did you get the antibiotic?
um, the Cipro, that one I got 4 days ago.
Okay.
And then basically, like as I talked to a few people, Sheila included, they mentioned that this antibiotic can cause a lot of dangerous side effects, especially for people who have my kind of tissue damage. So I went back to her and she gave me she walked me through the Genova report where there's like 4 other antibiotics that can be used to kill my infection. And she just said that, for me to look into one of those 4, and um, then we can proceed with one of those.
Shiva, I'm going to pause you for a little bit. And sorry to do this back and forth with you.
No.
Remind me the infection.
The infection name.
I don't see that in my notes. What was that?
The name of the infection?
Yeah, what kind of infection do you have?
Okay, so 1 second, let me go back to the report.
Was I given those notes? Because I saw your Nutrival.
Did you get my Genova report?
Let me go back. Yeah, there's the Genova report. Okay.
So if you open that and go to page 6.
Sorry, I'm just walking through everything else I'm seeing too as we're doing it.
No problem.
The Klebsiella pneumonia?
Yeah.
No kidding. And they gave you Cipro, and they didn't give you ampicillin for some reason. Oh, because it's resistant. They gave you, okay. Got it.
Let me go back.
You get Klebsiella pneumonia.
Is that like from autoimmune condition?
No, it's a powerful bug. It's a big hospital bug. When you had an issue way back when in 2011, and the motorcycle accident, did they hospitalize you?
Yeah, I mean, like for a bit.
Yeah. How long? I'm trying to think. I'm trying to figure out where you got Klebsiella from. That's one of the big 5 superbugs in the hospital.
Okay. I mean, I got hospitalized just a few times, like when I had my sinusitis surgery in 2014, and then gallbladder surgery last year.
Okay.
But I wasn't kept like overnight or something. It comes from like IV or?
It can. I mean, it doesn't have to be from an IV. It can just be you're in the. I mean, the most common place you're gonna get it is in a hospital or in like a nursing facility, where these bugs, are just thriving on, people whose immune systems are weaker. They're just more rampant. This was a stool test. Tell me more about the test, the Genova test. It was a stool antigen?
Yeah, basically, I think the process she told me was that it's a stool test, and then they take parts of the stool and then they test the antibiotics on it, and then I think it's called
you
culturing.
Answered it. Genova is a good stool test. No, you answered that question well.
Okay.
I just want to make sure I'm not missing something. And the doctor prescribed is the same doc who ordered the test?
Yeah.
Okay. All right. So I'm assuming your question is, should you take Cipro or one of these other medications to kill the bug?
Yeah. Like which one would be the safest, but still has enough power to kill the bug, I guess.
Did you ask her why she didn't choose like the Augmentin or the tetracycline or the Bactrim?
I didn't. I just mentioned to her that I don't feel comfortable with Cipro, and she said that she treated people in the past with Cipro and they didn't get tendon rupture. But she was like, you can, do a little bit looking into and see what you're comfortable with, because I'm also like, she's also not like a, like, how do you say it? I'm way more sensitive than her usual people, because she's not like a specialist for like like people like me, like CCI and everything like that. She's more um like a kind of like a general doctor overall, I think, health and wellness and everything like that. So she understood that might be something else that's good, but I didn't ask her like specifically why she chose Cipro.
Okay. Um, so in your case, because you're having all this brain fog and stuff, I guess Cipro I'd be a little nervous about. But why don't we just talk about each of these three? I think there's five, but there's a few of them I don't like. The cephalothin, I believe that's IV only. The Cipro, I'm not the biggest fan of. For you, like, I've given it out a lot, but at the same time, it's someone who's having kind of these brain fog issues, I get a little nervous. So let's talk about the other option, right? You have the Augmentin, which is amoxicillin clavulanic acid. Amoxicillin is a really subtle antibiotic, right? We give it to kids all the time. We add the clavulanic acid if they're like resistant, right? So if we want to have an ear infection that isn't getting better in a kid with amoxicillin, you'll add the clavulanic piece, and that's what gives you what's more familiar as Augmentin. Let me know how you're following. Sorry, I'm looking at your labs and your notes, so I'm not seeing you so well. So I got to go to that screen to see you.
Okay.
So I'm okay with the Augmentin. We give it to people with headaches. So that's the amoxicillin clavulanic acid. It usually takes a longer course, so it may take like 10 days as opposed to like Cipro. You may be able to get away with something like 3 to 7 days. But I think it's a lot gentler, right? The side effect of Augmentin is you're likely going to have diarrhea. It's going to cause some GI issues, more than likely.
Okay.
Not the worst thing in the world. It's probably the safer of the two, if I were to think about it. The cephalothin, I'd have to look into it, but I think that only comes IV. But since it's on here, I assume it comes oral as well. It's a first generation cephalosporin. It's like it's similar to like Keflex. So if it comes oral, it's not a bad option. The tetracycline, it can yellow teeth. I'm not a big fan of it in younger males, especially. But it's not a horrible option. You can't go in the sun if you're taking tetracycline, which I think you're on the East Coast now. I'm not too worried about you being in the sun, right?
I'm in Arizona, yeah.
Oh, you're in Arizona.
Yeah.
Were you on the East Coast too, or were you always in Arizona? You were in Arizona because Deborah Heath. I give you Deborah Heath, Steve Davidson, and others. That's right.
Yeah.
So actually, I don't like tetracycline for you because you're in Arizona.
Okay.
And then Bactrim. Bactrim isn't a bad option. It's strong. It can be a little dirty, but overall, like, people use it a lot. If I were to pick one of these here, I'd probably go with the Augmentin for 10 days. Dentists give it out a lot, like, for dental issues. We give it out to kids a lot. It's just the cleanest of them all.
Augmentin is the amoxicillin, right?
Yeah, it's the amoxicillin clavulanic acid.
Okay.
So you can look that up.
What I was gonna say is I tolerate almost everything way better with IV. Like with IV, I can take all my nutrition stuff, but I can't take it orally. So should I be looking into like the cephalotin?
Except where are you going to go get IV antibiotics? That's going to come with a cost. You're going to have to go to an office and get an IV in you, because I don't think you're going to, like, no hospital's not going to take you in. So it's more costly. It's doable, but it's just more costly.
And insurance doesn't cover it?
No, your insurance is going to cover something that's going to be oral. They're going to say, because these other things come in oral forms, we're not going to pay for IV. That's how your insurance is going to do it. If it only came in as IV, right? If all your options said it has to be an IV antibiotic, then they would do it. Your insurance will not cover this IV, especially because this test did not come from like a LabCorp or a Quest or something that your insurance works with.
Got it. Do you know approximately like how much it would cost if I was to be able to get an IV, like with these kind of things?
It's going to be in the hundreds or thousands, because honestly, I don't know how many doses you'd need for Klebsiella.
Okay.
So let me see something here. Yeah, so you can use Augmentin. I would. So, are you tending towards diarrhea or constipation right now?
Constipation.
So you may actually like the Augmentin, right? It may actually like help your bowels out, to be quite honest. Like even though you may have diarrhea, like it may actually help clean out your system, and then get on a good probiotic, during, but especially a hard amount, good amount immediately afterwards. Like when patients tell me they have issues with constipation, I'm like, let's do the Augmentin and see what happens to your bowels.
And what if,
Let's see if we
like,
can
since I
reset.
cannot tolerate, like, any kind of foods and stuff, so would something like this, like, cause me to get, like, a flare-up and, like...
It can, but it also, honestly, it could potentially clean out your system. Like it's a gamble. Like it's a risk, right? But the risk may outweigh the benefit here. I'm sorry, the benefit may outweigh the risk.
Right. Got it. Okay, I understand.
And I'm gonna say, like, whatever we talk about today, like I'm gonna want to sit with it, and I'll get back to you, either tomorrow or more likely like at some point this weekend, and say like, here's what I think about it. I may talk to colleagues, I may just kind of sit on and think about it some more.
Sure.
But right now, I'm inclined to say let's do Augmentin.
Okay.
Right. I want to kind of talk to you. So let me take some notes here on that you tend towards constipation regardless. So, what is your meal plan right now? Because I know back in the day it was kind of salmon and very limited.
Yeah, it's salmon and sweet potato now still. It's getting even a little bit more. Before I could make the salmon with a little bit of garlic, but now I have just strictly salmon with salt and then sweet potato.
All right, so... All right, what else? Do you have questions regarding that?
That was my biggest two questions with that. Other than that, we can kind of get into anything you have, and then we could, I guess, venture into some of like, summarizing what treatments I did since we last spoke, and then talk, and go in that way, I guess.
Yeah, I had your... Let's go to the other test you had done, the Nutrival, because I had that one up.
Okay.
Who, by the way, the ordering doctor, where did you see this doctor?
So I went to a local, it was like 4 or 5 months ago, I went to a local doctor who does, like who can get me LDN, and then he saw how sensitive I was and said that I need more attention than their facility, so he referred me to Mederi Health. This is the doctor in Denver, Colorado, and this is the doctor that I've been working with to get these tests, and the idea was that she hopes after we can kill this infection, she believes that I'll be able to start tolerating some foods. So that's like the whole idea with this line of this doctor work that we're doing.
I totally agree, which is why, I'm almost inclined to say if we put you on an antibiotic that's also going to hopefully kill the infection and cause some GI stimulation, it's not a bad option.
Okay.
Does that make sense? Which is why I kind of lean towards that Augmentin.
Okay. All right, I'll tell...
Another option...
Yeah.
Go ahead.
No, I was going to say, I'll tell her, like, we can do the Maxavilin with the addition.
Yeah, it's called Augmentin. The other option, Shiv, honestly, in the complicated cases, I've called Genova and I've talked to their staff, their team, like their, one of their head doctors, and they'll look exactly at this profile because you've got all these kind of imbalances in your bugs, and they may recommend, which antibiotic, but also in combination, which probiotic or probiotics might be best for you. So it's an option. I don't know if they'll have the conversation with you directly. Rarely have they. I don't think they have. But if you want, I can do that. That's normally what I'll end up doing.
Okay.
For the complicated cases. Look, if it's quick and easy, it's fine. If it's going to take a while, obviously I'm going to pass on that fee to you. But I just want to kind of put that out there.
Yeah,
so
sure.
that's an option too for these complicated cases. Okay.
That'll be great. I mean, last time we tried probiotics, I couldn't tolerate it, but maybe after the infection's gone, who knows? Maybe I can tolerate it.
So this is actually what I want to know if I'm going to talk to them. What probiotics did you try that you couldn't tolerate before?
1 second. Let me get the name. It's in my email. This
And if
was
you want to just email that to me later, if you want to go get it, we can talk now. That works too. So I'm not going to call that.
yeah. Let me just take a note down. I'll have
Okay.
to basically find it. Okay. Got it.
Now, I assume they're going to talk to me, but they may need permission from you to talk about your case since I'm not the ordering provider. Like, I've never done it before, but I'm not the ordering provider.
Okay.
Test. So we'll see what we can get done.
Sure.
But there's an easy workaround for that. There should be. All right, what's next?
I opened up the NutriVal.
Okay, so let me pull that one up too. Okay, so boy, there's some things happening here on the NutriVal. Okay, no, you have some methylation imbalance. Have you had an MTHFR test?
No.
Okay, so MTHFR, it's a gene. It's a tell you if the test itself tells you, hey, are you able to metabolically process a lot of B vitamins? Correct, right? It's actually, you have to methylate vitamins so they can actually be used and you can create ATP. If you have a methylation defect, which is about 40% of people do, then there's an issue with that. Now, on your methylation pathway, it says it's a 6, which isn't the worst, but you have a lot of decreased values for your B vitamins, like the various different B vitamins, which makes me concerned of, hey, are you actually able to use the B vitamins appropriately? If your body doesn't methylate the B vitamin, your body can't absorb it and metabolize it properly to give you energy. Does that make sense?
Okay.
And dude, it's gonna be like goodbye to a lot of fatigue and just suffering. All the consequences of that, which could potentially be brain fog, clarity, sleep, GI, everything related to your body's need for energy. I think it's worth doing a methylation test on you, to be quite honest. Some insurances cover this. If you've done a test on 23andMe, have you done a 23andMe test?
No.
That's like that ancestral test. You can take your results from that, plug it into a genetic genie, and it'll tell you if you have any methylation issues. But there's all sorts of ways of doing a methylation test. And I do think it's worthwhile.
Okay.
And we'll get into kind of the specifics as we go through this, but I wanted to kind of just get that on the surface to identify where you were with that.
Okay.
Okay. So a couple of things here. Some good news, some bad news. Bad news being, hey, there's a lot of things here that are off. The good news is, oh my goodness, that's fantastic, because if we can get these things in order, like, it's probably a reason for why you're having a lot of these issues. Does that make sense?
Yeah.
It's more concerning if you're like, hey, all these things were normal, and it's like, well, but you're still having these GI issues, right? You can't tolerate foods.
Right. Yeah.
So this is good news.
And there is cures for these things.
Yeah.
That's the good thing. Unlike, something like my autoimmune condition and whatnot.
Correct. All right, so let's jump in. Your first batch is the antioxidants. Look, for the most part, other than CoQ10 and vitamin C, everything's kind of not at the ideal number, but this doesn't stand out, as bad as the other stuff coming along, right? So we're just kind of taking some information. The B vitamins, holy smokes, you are low, pretty much across the board, other than biotin, B7. Are you taking any B vitamin supplements?
That's the thing. I've been taking weekly IV, and it's a big bag of big B vitamins.
You're getting weekly IV vitamins? B
Yeah.
vitamins? Where do you go for that?
They come to the house. It's IV, mobile IV nurses. That's the company.
Do you know what kind of B vitamins they're putting in you?
I could find out. Like they do a bag. It's called Myers Cocktail, and then one of the things in that cocktail is the B vitamins. I just don't know which ones specifically, like B1, B2, or something like that.
Okay, so this explains a lot. Shit, if you don't mind asking, what are they charging you for that?
They charge $200 per session.
And how long have you been doing it for?
I think it's like the third month.
So you've been doing it for 3 months weekly. Okay.
Well, I missed some weeks. Some months I did it like 3 times, like that.
Okay.
But yeah, more or less.
And how long ago did you give them your stool sample?
So we started doing the tests with this doctor like about 2.5, almost 3 months ago. But stool was the most recent one, I think. It was like about 3-4 weeks ago.
Okay. Oh, you just had a birthday too. Happy belated birthday.
Thank you.
Okay, so the fact that you're getting these B vitamins in and these numbers are so low either means they're giving you some poor quality stuff, or your body's not absorbing them, or both, right? And so this is where I think you need to find out from that mobile unit what form, and just ask them, what form of B vitamin are you putting in there, or specifically B12? But you want to know what form, and you want to. That's the first question you ask, and they probably won't know. They're going to be like, and your follow-up question is, well, is it methylated B vitamins? Is it a methyl B12? And my assumption here is that the answer is no. And now that I see these numbers and you're telling me you're getting the B vitamin injections, I'm like, you must have a methylation defect.
Okay.
Which probably explains why your CoQ10 is so high. Are you getting any CoQ10?
No.
Okay.
But if that's something that's in salmon, then I would have it high.
Yeah. Okay, so let's find out what form of B vitamins you're getting, and then let's get you a methylated test, and then let's switch you over to methylated B vitamins.
Okay. Methylated B vitamins. Okay. That means even if my body's ability to break it down and turn into ATP is not good, it will be fine because they are already, the work is already done.
Yes, and I may give you some more supplements to support the methylation pathway, but man, when I see this, it's like there's definitely an issue. When you tell me you've been taking weekly B vitamins, find out what dose and how much. Like these, and they like you have records. I mean, you have a right to those records, so get all that information.
Right.
Say, hey, I need a copy of what the dosing has been and what type of B vitamin, what's in the multi B vitamin specifically, and if they're methylated.
Okay.
And they're probably going to try and not answer those questions because they're going to find out that you're going to realize it's the cheaper B vitamins. Is my guess. Honestly, it's my hope to see that these numbers are so low.
Okay.
Your magnesium is low. Are you taking any magnesium?
Yeah, it also has magnesium in that packet.
Are you taking any orally or no?
No, I cannot tolerate it orally.
You've tried, huh?
I've tried. I tried magnesium citrate, and I have issues.
What kind of issues? That's a rough one to take.
It was like what? Loss of balance, dizziness. I also feel like I'm on the verge of vertigo attacks constantly after taking that.
Okay.
But only for orally. If I take it IV, then I'm fine.
So you're getting an IV once a week, it sounds like, correct?
Yeah.
Okay. One of the docs I wanted to reach out to regarding these is, okay, good deal. So let's see. So I think we need to treat the bug, and then we need to switch you to, we're going to try a healthier, more subtle magnesium on you. don't take the citrate. It's too GI intensive. It's abusive.
Okay.
The ones that probably work best for you are going to be threonate. Is a really good one. God, I think that might be best with all the neuro issues you're having. Yeah, so we'll get like a good quality magnesium.
INATE?
TH, hold on, let me write it down so I can see it. THREONATE, yes.
Got it. Okay.
Good methylation test. Okay, what else do we have for you? Magnesium, we got to increase that. Magnesium, good. There's zinc. Are they putting zinc in that IV, or is that from your fish?
Zinc.
Find out what's in that IV bag. See if you can give me some information.
Okay.
Surprised that you're. Yeah, we gotta fix your food, man. Okay. So we gotta treat let me talk to Genova. Let's see what we can get for you. I'm going through the rest of your tests, see if there's anything else that really stands out.
The platelet count.
Yeah, you mentioned that in the notes. I have my notes from from when we were on the phone. Yeah, you had some not so good levels of mercury, and that's from all the fish you're taking.
Yeah.
That stood out too. We can consider giving you. So there's two ways to do chelation on you. Let me go back so I can see you now. Do you want to do anything about the mercury? Because that's a big amount. That's a lot.
Yeah, I mean, it looks like I'm like almost like I have mercury poisoning, right?
Your Wi-Fi reception.
Oh.
Shiv, are you there?
Yeah, I can hear you then.
Oh. Okay, say it again. You said, asked if you want to get rid of the mercury, and you just started with a couple words and it cut out.
Oh yeah, I was saying that. Yeah, I mean, looks like I have like pretty much mercury poisoning. So,
yeah.
But that's the catch-22. It's like, how do I stop eating the only I can only eat sweet potatoes then if I stop eating the fish. So that's the challenge there.
So this is what I'm going to go in a stepwise fashion. Here's my recommendation. Let's treat the Klebsiella. Let's get rid of the bugs and the infection. Let's get your GI going as much as possible, if we can. Right. Then you're going to have probably two main options to get rid of the mercury. And hopefully, as your gut gets better, we can take you off of the salmon diet, and we can slowly start to introduce you into other things, which I'm sure you're just craving for. I don't know if you're able to see my video. It looks like it just disappeared.
I can see it, yeah.
Okay. And then when your gut's going better, then we can hopefully decrease the amount of salmon intake with options that don't have, mercury. that you like as well. And then we can either do like chelation therapy IV, assuming we can get you in offices, or if the mobile clinic does it, or we can give you like cholestyramine, which is going to bind in your gut and you're going to poop it out. Both aren't bad options. I think the cholestyramine is probably going to be the simplest for you, and we can talk about that as well. But it's going to be a stepwise fashion. I wish we could just run there, but we can't.
So choline, you said?
Cholestyramine. The spelling on this one I'm not so good with.
No problem.
Let me try it out. So, chelation therapy, CHELATION. And then cholestyramine is CHOLYSTERAMINE.
STRAMYNE.
AMINE.
Oh, got it. And this is like through IV or?
No, it's oral.
It's oral. Okay.
It's oral. Yeah, we'd write you a prescription for it, and it's going to help bind things up. It's going to make your stools look a little fatty, but hopefully you'll be able to poop out more. They also use it a lot if you've had mold toxicity. I don't know if that's been an issue or not potentially, but it'll help bind that up and do that up as well. Huh?
Potentially, yeah. We did some home tests and the mold was high, but I don't know in me.
So this will be good. There's an online test. Man, I can't remember the name of it. Give me just a moment. That you answer a bunch of questions, and it's a good test to see if you've had mold toxicity. Give me just a moment. You can look at recoverfrommold.com. Which one's this? I may have to gather these things and send them to you.
Okay.
Or you can do the macrons test. Yeah, let me figure that out. Let me add that to the list too. But I don't think that part matters, to be realistic with you, because you're gonna have to do these things regardless, is what it sounds like, because of the mercury, anyways. And I think because you have the mold, you're gonna use cholestyramine, or the potential for mold. Does that make sense?
Okay, got it. Because it can maybe do 2 birds in 1 stone type thing.
Yeah. And if we could, 2 birds, 1 stone is a bonus for you.
Right.
A big bonus.
Yeah.
But I need to make it so your gut's not going to kill it, be upset. So mercury. Okay. Well, I feel a little more scattered today because I didn't get a chance to review that lab. You threw me off with that Clips yellow one.
Okay. No problem.
Okay. So let's jump into the rest of that, which I think we just hit. That was your toxic elements. That mercury one really bothered me. I think I focused really on this NutriVal one that I missed the other one, so I apologize.
That's fine.
Okay, so let me make sure I'm not missing anything else. Let me go back. NutriVal. What is this SC result report? I can't remember what that means. Oh, that's your A1. Oh, this is where you had the high LFTs, I think, a year ago.
The GL effects PDF?
What is this one called? It's by LabCorp. It's the CMP14. It has your uric acid on there. It's kind of on the first page. It's 5 pages. Yeah, this is the one where AST-ALT was a little high. They're not horribly high. It's not good, but it's. I mean, they're not what we want to chase right now. We need to look at the other things.
Okay.
Ferritins. You're having iron issues. Yeah, you are quite the case. Your C-reactive protein is super. It's high for someone your age, but not for what you have going on. Vitamin D is good. You can actually back off a little if you needed to. Yeah.
That's probably from the fish.
Oh, really? You're not taking a vitamin D supplement?
No.
Wow. Okay. All this other like GI stuff. I mean, not the GI, but the cardiac stuff. Like we can't really do much with until we clear out you of the infection process. Does that make sense?
Right. Makes sense.
So this was good to have, but I was kind of like, I don't really know what to do with this thing right now. It's just kind of, the good news is nothing was horrible. That's what I would say here. Your inflammatory marker, that C-reactive protein, that was high, but no surprise.
Makes sense.
And your thyroid was good, which was great. I mean, that was the bonus.
So one of the tests before,
right.
I got confused with this part, is that they said my thyroid is like trending towards what is, I think it's called Graves' disease. It's like, they said something was, I know, not looking good in my thyroid. It's
Did they have antibodies?
Sorry?
Did they have thyroid antibodies?
I'm not sure.
So take a look on page. It's labeled as page 3 of 5 of the LabCorp document. Now let's go through this with you. Let me help you out.
Okay.
Let me know when you're ready.
Page 3, right?
Yeah.
Yeah, I'm there. Wait, no, I only have two pages. Let me see. LabCorp. I'm not sure if I have.
Can I do a share screen, do you?
Yeah.
No, ZocDoc does not allow me to do a share screen. Here,
But-
why don't I just send it? You send it to us, so I can send it back to you.
Okay, sure. I mean, like you said, I don't think it's like as important as you mentioned. These are more important. I guess the main thing from that would be like, do you recommend a blood transfusion?
What is your intention for that blood transfusion?
Because the same doctor said that my platelet count is low.
Which lab was that? I didn't see that on here. Did I miss it?
She put it in the recommendation little
here
document.
it is, platelet. Platelet had a platelet of 94. Honestly, when I see that, I'd repeat the test.
Oh, really? Okay.
Yeah. So if it's just once and it's low, repeat the test before you go get blood in you.
Okay. All right. I'll just get another platelet count.
I mean, you're asking the right question, but this is one of those where, I mean, even if you went to the hospital and they say this number was low, they would not transfuse you. They would repeat the test to make sure it's legit.
Got it.
So, I mean, my first thought is we got to repeat this test. And that's a cheap, easy test. It doesn't have to be anything fancy. You can go to any clinic and get a CBC or just a platelet count, and it's cheap.
Okay.
It's like cheap. You're going to pay more for the blood draw than the actual test. The test should be like $8 to $15. They're going to probably charge you $30 for a blood draw.
Okay, got it. So
Does the mobile clinic take blood? Can they draw blood?
they can't draw blood.
All right. Okay. Let me put some notes here.
And that's another thing I was gonna say. Even Sheila was saying that to ask you if you know somebody like locally, just like you knew the other doctors. If you know somebody locally who has like admitting privileges, if I need to be admitted for like IV or hospital kind of privileges, things like that, like a local doctor.
For internal medicine, potentially? Which hospital? It all depends on the hospital.
In any, I guess, like we were just speaking how, like, you know, for somebody in my condition, it's good to have, like, you know, if something comes up and it's like quickly be able to talk to a doctor and then get on some kind of protocol, or like, let's say something does get low platelet wise, I need to get a blood transfusion. I don't have like a local doctor. I have, you know, you and a couple of doctors. They're all out of state, but nobody can. I think the way it works, you'd have to have a doctor who's in the same state as you to admit you in the hospital, right? Or
Yeah. I'm trying to think. I know Victoria Troncoso. She's a DO. She's also the chief department in Arizona, the DO school there. And she's an internal medicine doc. I don't know if she still has admitting privileges or if she uses them or if she still practices internal medicine. But she would know someone because, she practiced there as an internal medicine doc who's, osteopathically minded. I would assume she would know someone. Who else? I would reach out to her, Victoria Troncoso, Troncoso.
okay.
Oh, the other one is oh man, he's a gem of a guy, Richard Dobrusin. He's at the other DO school in Glendale. He retired from his practice, but he knows the community. I mean, he had a full thriving practice and I believe he had admitting privileges.
Okay, awesome. Richard
Dobrusin, Dobrusin. In fact, I just texted with him last night. I haven't talked to him in years.
Okay.
So I know he's around. If you have any issues contacting him, I can ask him. Does he? Let's not use that up yet until we need it.
Okay.
Does that make sense?
Right.
When we need it, we'll definitely use it. I just want to make sure, since I don't talk to him much.
For sure. No, thank you for that. No, yeah, I'll just I found him on Google. I'll reach out to him. Hopefully, he can possibly be my primary care.
Ask who he recommends and say, hey, you and I have spoken. I recommended, contacting him to see if he recommended anyone with admitting privileges as well. And he also works for Midwestern University. So if he's not responding to whatever email address you find his Midwestern University email because I know he works there.
Got it. Okay. That's good.
He just published an article. He was one of the providers in the article. That's how I found. That's how we connect.
Oh wow. And so he's somebody who knows like complicated cases.
He knows the
and stuff.
town. He knows the dude can retire. He's just practicing for fun.
Okay.
Yeah, he's well experienced.
Wow, that's great then. Hopefully, yeah, I'm looking forward to that then. Because I was talking to some other people in the Facebook group. And they said I need to. Somebody in my condition needs somebody locally who can at least coordinate with certain things, get tests done, expedite stuff, that whatnot.
Yeah. He would know the guys in the area who take insurance or are open-minded. That's what you're looking for. Because he's still there, right? And he grew up and he created a huge practice in that community. When I was a medical student, I didn't just rotate with him. He was my mentor.
Oh wow.
And at that time, he was building this practice that eventually got bought out and sold off. But he had a huge practice before even that started. He was a mentor to me and other people in my class. He was well experienced at that time.
Got it. That's really great.
Yeah.
Okay.
All right. What else do we got? Because I want to make sure we got to take care of you. I don't want to miss anything. I have my to-do list here. You're going to look into what you want to do for the methylation test. Honestly, if you can get your insurance to pay for it, then just do it. Or look into 23andMe, or if I need to order it, I'll order it.
Okay.
There's another genetic profile test, which I think it may give you your methylation, but I think that test is $600. It's they swab your inside of your cheek, and it'll give you a whole bunch of other genetic information, good tests as far as your metabolic pathway. And that's a one and done. You'll never repeat that test again. It just tells you about your genetics.
Okay.
It's interested in that one. But it's $600. I don't know if you are, but it'll probably give us a lot of information as well.
Yeah, if it's something, if the other information could be useful, then we could do it. I've been paying most of this out of pocket. Do you by any chance also know any health insurance that's good that covers a lot of this kind of stuff? Because I'm using Liberty HealthShare and it doesn't seem like it covers much.
Yeah, they're not. It's even a bear to get them to cover the methylation test, but in your case, you may be able to because of the B vitamin issues. But it's really challenging. The genetic test is never covered. That specific one.
But generally, let's say, if I was to get a blood transfusion or something locally, is that
your regular insurance should cover that?
should cover.
Like your platelet count, your regular insurance should cover. Like your CBC, your thyroid test, all that your regular insurance should cover.
Okay, got it.
Not through Genova, but through like, the standard lab places, the Quest, the LabCorp, the hospital system there.
Got it. I'll check in with them and see like if they do, because it just started
Hey,
in October.
who do you guys contract with? And actually, why don't you get the name of your insurance and ask Dalberson, like, hey, do you know anyone who may accept my insurance? Whatever the name is, locally in the area as well. See if, or you can ask him, is there a better insurance I should have in this area?
When I reach out to Dr. Richard Dalberson.
Dalberson, yeah. I mean, he's, at least back in the day, like, he knew all the answers.
Got it. Okay, awesome.
What else? By the way, to answer your question about the thyroid stuff, on that NutriVal test,
Yeah.
which you sent to us, it's your thyroid stuff is on page 3 of 5 of that NutriVal test. No, not the SC test. SC something. You titled it. Were you able to find it, or do I need to send it to you again?
Let me look again. So it says the only SC one I have like SC payment plan. That's the
Here, let me just send this to you right now so you have it. All right, I think I just shared it with you on Google.
Okay.
Oh, Andrea might have retitled this, so you may have it called something else.
Oh, okay. I see another one though now. I think this is the LabCorp, has like a lot of small numbers.
Yeah.
Okay. And then you said page 3?
Page 3 of 5.
Okay, yeah, I see it. It's like numbers at the top, then there's a paragraph of text in the bottom.
Yeah. So their C-reactive protein is high. Obviously not ideal. It says you have markers of inflammation. The homocysteine is 10. It's 9.9, right? Normally we want that under 7. Because it's not under 7, something tells me you have a methylation issue. This has to do with your B12.
Okay.
And then the rest of it is all thyroid related. Your TSH is good. It's between 1 and 2. Fantastic. Your T4 is good. Your T3 is good. Like it's, we want around, 25 to 30, which is what you are, that T3 uptake. And then all this other stuff towards the bottom, the thyroglobulin antibody, the thyroid peroxidase, those all are markers for Graves' disease or Hashimoto's. Like that's an autoimmune thyroid issue. Your numbers are normal.
Oh, wow, okay.
So that's good news. So that's what we want. So, I mean, your thyroid made me very happy.
Okay, that's great then.
Yeah.
I thought for a while I had like Graves' disease because I lose weight really easily, all this stuff. I thought that was like thyroid related.
Well, right now, whatever you're doing, we know that it's happy. So in the future, if those numbers come back up again, you need to transition your diet to something that's more autoimmune. So it's going to be salmon light, but hopefully going to add healthier things, right? And you're not just taking in things with mercury. So just know if that thyroid ever becomes an issue again, it's probably your diet that you need to adjust.
Got it. Okay, awesome. Just to kind of, I'll just like run through what I'm kind of like thinking with everything we just talked about, like the sequence-wise, including the stuff we had planned before. So from last time, the major things was like stellate ganglion block, OMT, and then alpha with jaw mark, as well as Dr. Scheipel with prolotherapy. So did stellate, so we're leaving that until, we're not going to do anything like that anymore for now until I get my gut. And then OMT, I did 4 sessions, and he feels that something's working, so I'm not sure, but we're keeping it going. For the prolotherapy...
Wait, hold on. Who are you seeing for the OMT?
Dr. Steve Davidson.
Okay. And so what did he say? Did you have any overall thoughts?
Yeah, he said that when you get into an accident, your body's flow, the structural flow can be off and rigid, and that's not flowing properly, and that's like what happened to me. My body's like rigid and it's not flowing properly, and we're doing work where it's like he's putting just like some pressure points in the base of my skull and then also in my hip and just holding it there, and that's going to help. I honestly, this is probably the one that I'm most confused about. I'm not sure how it actually works. But he lets
So you
me.
haven't noticed any benefit yet?
I'm not noticing anything yet, but he says that it's like the blockages are, like looking to like clear up and starting to move around a little bit. And he thinks after a couple of months it can be better.
Okay.
So I'm not sure.
Okay.
And I know you mentioned that also do cranial sacral therapy, but with the OMT, I'm not sure if I don't know if he's doing that yet, because is cranial sacral therapy more like a massage or something?
No, he's doing it all comprehensively. Don't worry, he's covering it all.
He's covering it
So
all. Okay,
I'm okay with that. Yeah. So yeah, you're good with that.
All right, so that's what we're continuing now, roughly like one every 2 weeks to one a week, depending on his schedule. So the last couple of times he's been a little bit more free, so we're doing it like almost every week. And then the thing I was gonna say is like, so since we're shifting things a little bit right now, like we're like, okay, we're prioritizing the infection, trying to get this removed, and then see after that a way to if we can like bind and take care of the mercury levels and everything like that, open up the diet. That sounds like it's becoming more of a priority. And should we be moving like the prolotherapy like after this session, or prolotherapy would be like third after like jaw appliance and stuff like that?
Let's get rid of the infection first. Number one, get rid of the infection. See how you do, and see if we can build up. And okay, so I'll make it easy on you. Number one, get rid of the infection. Okay, so we got to figure. We'll come up with that. Give me a day or two to kind of over the weekend to kind of figure out which antibiotic is best. But I'm leaning towards augmentin, especially with a history of constipation. I think risk benefit. I just think it's worthwhile. Then let's get a methylation test on you and make sure that you are getting the right forms of nutrients and methylated B vitamins. Okay, and when you need to buy methylated B vitamins, let me know. In the meantime, I'm not. How do I get you? We got to get you to a doc who can give you. You can get injectable methylated B vitamins.
Okay.
Right. I don't know if I can prescribe them to you because I'm not licensed in Arizona.
Got it.
But we can order them through a compound pharmacy, and you can either inject yourself, have a friend inject you, when these guys can give you an IV. You can tell them, put this specific B vitamin in that IV, not your cheap stuff.
Okay.
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 The cheap stuff is either cyanocobalamin or hydroxycobalamin. And cyano is just like it sounds like. It's a derivative of cyanide. You want the methylated B vitamins.
Okay.
So once those two things, right, infection's gone and your nutrition and methylation products are better, whatever injection we do to you, whether it's prolotherapy or other treatment forms, your body will be able to do a lot better with. So those two pieces are number one.
Okay.
And in fact, if we were to even go, the next step, trying to get your body nutritionally better, we'd probably start the cholestyramine or whatever you need to do to get rid of your toxic mercury.
Okay.
I would do all those things first before really trying to say, let's jump in a prolo.
Got it.
Because if you're absolutely miserable and like, hey, let's do the prolo right away just to give me some sort of symptom relief, I'd say, okay, we can do it. But if you're like, hey, I want my best bang for my buck, I want to, when I get injections in my neck or do prolo, it's going to be as effective as possible, we got to get your nutrition and health and your body functioning better.
Got it. Okay.
Makes sense?
Yeah.
Okay. So that's the overall plan.
All right. Sounds that sounds like a plan now.
Okay. So let me just document that before I forget. So infection nutrition. Yeah, the appliance. Let's just get you nutritionally better first, because even if we put an appliance in your body is suffering, it's going to be really hard. Now, where are you right now as far as? It sounds like you got your vaccine. You want to travel. You went and saw Brian Scheipel. Are you comfortable, getting out of your house a little more now?
Yeah, I'm not as scared to get out of the house anymore.
Okay.
Yeah.
All right. So let's do that, and let me get back to you. Let's connect either by email or a quick phone call early next week, and I'll let you know what I need to hear back from Genova too, so I need to see what I can do to connect with them.
Okay.
To talk about your case. I don't want to. It's easy to say, hey, let's just do all this stuff, but you're so complicated and so miserable as far as food wise. Let's just see if we can get a couple heads together and do it, even better.
Got it. Thank you so much, Dr. Nouranni.
Yeah, no problem. Anything else I can do for you?
Oh no, that'll be it. That sounds really good for now. So we'll talk next week then.
All right. Hey, if you don't hear back from me by Sunday, Monday, just send me a message. I'll probably say, well, my assumption is if you don't hear back from me, it's because Genova pushed it out the conversation a few days. Sometimes it takes a while to schedule in.
No problem. We'll do. I'll reach out to you if I don't hear back.
Okay, and we're going to get rid of these infections out of you. That's what I want to do first.
Yeah.
We'll talk soon.
Thank you. Okay, talk to you soon. Take care.
You're welcome. Hey, repeat that platelet count, number 1. You've got to repeat that thing sooner rather than later.
Got it. We'll do that. All right. Bye.
All right.